The truth about acid reflux. Most people never hear that burning sensation rising from the stomach into the chest, especially at night, is one of the most common complaints among adults worldwide. More than 1 in 5 people experience it regularly, and for those over 35, the risk grows with every passing year. It's easy to dismiss as a minor inconvenience. It rarely is. Repeated acid reflux doesn't just cause discomfort. Over time, it can damage the esophagus, erode tooth enamel, disrupt sleep, and silently progress into a more serious condition known as GERD, often with few obvious warning signs along the way. The standard advice, avoid spicy food, cut out triggers, take antacids, is familiar to almost everyone who has dealt with this. And yet for many people, the burning keeps returning, sometimes more intensely, sometimes at night, sometimes first thing in the morning. The reason that advice falls short is that it targets the wrong problem. What acid reflux actually is. Acid reflux is fundamentally a mechanical problem, not a chemical one. Between the stomach and the esophagus sits a muscular valve called the lower esophageal sphincter. Its function is straightforward, open to allow food into the stomach, then close tightly to keep everything down. When this valve is working properly, stomach acid stays where it belongs. Reflux occurs when this valve weakens, relaxes too frequently, or fails to seal completely. Stomach contents travel upward into the esophagus, a structure that, unlike the stomach, has no protective lining against acid. This is why reflux symptoms can appear even when acid levels are completely normal. The acid itself isn't the root issue. The faulty valve is. 2 common myths worth clearing up. Myth 1. Skipping meals gives the stomach a rest. In reality, an empty stomach can still produce acid, and without food to buffer it, that acid becomes more irritating, not less. Skipping meals also increases the likelihood of overeating at the next meal, which raises stomach pressure, one of the most reliable reflux triggers. For most people with reflux, regular portion-controlled meals are far more effective than prolonged fasting. Myth 2. Only unhealthy food causes reflux. Reflux affects people who eat carefully too, because it's influenced by much more than food choice. Portion size, eating pace, meal timing, and stress levels all play significant roles. Digestion depends on coordinated nerve and muscle activity. When eating happens under stress, in a rush, or while distracted, that coordination breaks down, and even a nutritious meal can trigger symptoms. When reflux becomes something more serious. Occasional reflux is common and manageable, but when it becomes frequent, the esophagus faces repeated acid exposure it isn't equipped to handle. The result can be chronic inflammation, painful swallowing, persistent cough, hoarseness, declining sleep quality, and dental erosion. In more severe cases, acid can reach the airways and contribute to respiratory problems. Reflux that occurs regularly and doesn't respond to simple measures deserves medical attention, not continued management with over-the-counter remedies. Why antacids don't solve the problem. Antacids and acid-suppressing medications do one thing well. They reduce stomach acid temporarily. That relief is real, and in the short term, it's genuinely useful, particularly when the esophagus needs a chance to heal from repeated irritation. But the relief is masking a symptom, not addressing its cause. A useful way to think about it: the stomach is a sealed bottle of fizzy liquid. Antacids make the liquid less fizzy, but they don't tighten the loose cap, and they don't stop the bottle from being shaken. The moment the medication is stopped, symptoms return, because the leak, the pressure, and the underlying triggers were never addressed. Specifically, antacids do nothing to strengthen the weakened valve that is allowing acid to escape, reduce the internal abdominal pressure caused by bloating, overeating, or excess belly fat, correct slow gastric emptying, where food and acid linger in the stomach longer than they should, change the daily habits, late meals, chronic stress, poor sleep, that are consistently provoking the problem. Treating the acid without fixing these factors is why symptoms reliably come back. 5 evidence-based approaches that address the real causes. 1. Eat smaller portions. Large meals stretch the stomach and force pressure upward against the valve. Smaller, more frequent meals reduce that pressure, support more efficient digestion, and significantly lower the frequency of reflux episodes. This is one of the most consistently effective changes a person can make. 2. Allow time between dinner and sleep. Gravity is an underappreciated ally in digestion. Lying down shortly after eating removes that gravitational advantage and makes upward movement of stomach contents far easier. Allowing 2 to 3 hours between the last meal and bedtime can dramatically reduce nighttime symptoms. 3. Elevate the upper body during sleep. Even modest elevation of the head and chest during sleep helps keep stomach contents down. This simple adjustment can meaningfully reduce both nighttime reflux and the morning irritation that often follows it. 4. Maintain a healthy weight. Excess abdominal fat increases pressure inside the abdomen, physically pushing against the stomach and the valve above it. Even moderate weight loss has a well-documented association with measurable improvement in reflux frequency and severity. 5. Manage stress and restore digestive rhythm. Stress disrupts the nerve signals that coordinate digestion, acid regulation, and valve timing. Practical habits: slow, deliberate breathing, a short walk after meals, and consistent sleep patterns help restore that coordination over time. These aren't optional lifestyle extras. For many people, they are the most impactful interventions available. Acid reflux is not simply a problem of too much acid. It is a problem of mechanics, pressure, timing, and the daily habits that quietly push those systems out of balance. Antacids address the discomfort. They don't address the dysfunction. When the underlying causes are identified and corrected, the valve weakness, the abdominal pressure, the digestive timing, the lifestyle patterns, symptoms often improve on their own without the need for ongoing medication. Sustainable relief comes from fixing what's broken, not from continuously managing what it produces.